Welcome everybody to the Kvara podcast, where we talk about anything related to pregnancy and the postpartum period. We're going to have a slew of guests from various different specialties discussing all different topics. Tune in and find out. Welcome to another episode of the Kvara podcast. Again, for those of you who are joining for the first time, I'm Dr. C. I'm an OBGYN in Southern California, and we have a very, very special guest today, Miss Amber Deakins.
Hello.
And we're actually here to talk about surrogacy. Amber has been a surrogate on more than one occasion.
Yes.
And I actually personally have a lot of questions, and I'm sure our guests out there that are listening probably have questions as well.
Okay.
So it's just something I'm really interested in and want to talk about.
Okay.
So go ahead and, for those who don't know, tell everybody what a surrogate is.
Okay. So I am a gestational carrier, and what that means is I'm the incubator, or commonly known as I'm the oven and I'm carrying someone else's bun. So biologically, the baby does not belong to my husband or myself. It is not my egg or my husband's sperm. So I will carry the baby for the full 9 months. I go into an IVF clinic where I will be inseminated with an embryo that is already at a 2-week gestational age.
Right.
So pending the embryo transfer, once I get home, 5 to 6 days later, I could take an over-the-counter pregnancy test to see if there's HCG in my system. And if that pops positive, within 10 to 12 days, I'll go into a clinic to get my blood tested and to see where my HCG numbers are. And they're really looking for anything over 100 to confirm a pregnancy. And then 2 more weeks following, I would go in for a fetal heartbeat ultrasound. And that's really when they say, okay, this is a viable pregnancy. And then the process really gets started there.
Right. So for all intensive purposes, you're carrying a baby for another couple.
Right. So it could be what's considered a traditional couple, which is a husband and wife. And for whatever reason, they have infidelity issues and can't conceive on their own. And so a surrogate is called into play. Or it could just be a couple where it's same sex. And obviously you need a man and a woman to have a child together. So surrogates obviously are needed for those couples as well.
Yeah, super important. And I think I just want to clarify, we meant infertility. I think you stumbled and said, I think you said infidelity.
Oh,
that could be happening as well.
Well,
and that certainly will prevent pregnancy.
I have some stories to share, but
that will certainly prevent pregnancy. What made you, I think kind of my curiosity and the biggest question is, you know, you're carrying someone else's child and will deliver. And it's one of the most selfless acts, which is amazing. But what made you kind of get into it? What kind of sparked that idea and how did you pursue it?
In my early 20s, I had worked with a friend who, she did multiple surrogacies. She was a surrogate and I would pick her brain all the time. And just like, you know, you guys might have these questions of why would you do that? You know, but your body's going to change, or how can you give the baby up to someone else? Like, you know, what does that feel like?
Right.
I would ask all these questions. Of course, what do you get paid? I would ask these questions to my friend and I would see her go through, you know, journey after journey after journey. And then I obviously had my own son and couldn't fathom being a surrogate, right? Because my first son really changed my perspective on things. Then when I moved up to this area, I started having mom friends that were surrogates and not knowing about it. It wasn't something that was well publicized or shared about. It was almost as if it was, first off, the family that you were doing it, I think there's some shame to them, especially if it was a man and a woman, as if there was something wrong. And so they would like to keep things private and not so much public. And so it wasn't really talked about. So I had some friends up here, same thing. I started getting curious again. So I went and I applied to be a surrogate. And I think my views at that time, this was like early 2009, 10. My views were different as far as like termination. You get asked a slew of questions that have to be vetted before you can even be approved, right? They couldn't find a match for me. And I thought, okay, so it just kind of ended there and I didn't pursue it. Well, what do you know? I got pregnant with my son, Elijah. And so that made sense, right? So I kind of got that spark again. Oh, I want to be a surrogate. You know, let me look back into this. Got pregnant with Amelia.
Right.
And it's like, okay, there's something greater than me that's trying to tell me maybe surrogacy isn't for you right now. So just hold off. Right. Had Amelia. And then I would say after a year of having her, I was like, knew I was done. My husband and I were done with our family planning, but I wasn't done being pregnant.
Right.
And that's really hard to explain to people who don't have good pregnancies. So a really big benefit is I have phenomenal pregnancies. I feel beautiful pregnant. Like I feel voluptuous and I don't know. It's just, I love how my body changes.
Suits you. Yeah.
Thank you.
Yeah.
And so, not much of my lifestyle changes when I'm pregnant. Like I'm blessed in the sense of I don't get the morning sickness. I've never had any complications during like labor delivery. And so I had this desire, we're going to try this again. And now, mind you, between this time, years have passed and my views changed on what I would be okay with in a surrogacy and what I would not be, right? One of them being termination. So at the time when I first applied, I would not allow the intended parents to be in charge of whether a pregnancy could get terminated or not. So that instantly closed a lot of doors for me, because if you think about it, it's not my egg, it's not my husband's sperm. I really have no legal right to this baby when it comes to like medical decisions, but it's my body. Right. So that's the big conflict.
Bodily autonomy is important. Right.
So as time passed, I changed my view that if something medically was going wrong with the baby to where a physician said, hey, it's in your best interest and the baby's best interest that we terminate this pregnancy up to a certain date, I then said, you know what, I would agree with that. And I would hand that over to the parents to make that decision, not for me to make that decision. The minute I did that, it opened up all kinds of intended parents who were interested in my profile. Yeah. So I went through an agency, obviously my friend who I initially started picking her brain about surrogacy. I went through her agency and they found a couple that I wasn't expecting. Another thing I realized from my surrogate profile that I was eliminating this whole other section of people. It was important to me. I think the way I had answered it, it was very generic. I would say like a married couple or a single man or woman. I don't remember if like same sex was put on the application at the time, but they had to be married. That's what I checked. I have plenty of friends today that have been in committed relationships for like 20 years, but they're never married. So I was automatically excluding them and not even thinking that. I have friends that are same sex, right? I was excluding them. Because at that time, I think we were going back and forth whether or not gay marriage could be legal or not. Once I started checking different boxes of my surrogate profile, it started opening avenues for intended parents to find my profile, through the agency. And so my first couple that came to me was a same-sex couple. And all I had to do is read their profile. So they write a letter to the surrogate. They send pictures of themselves and why they're seeking a surrogate. Instantly started crying. Like it touched something personally for me that I didn't have to look through the rest that came my way. I want to work with this couple. And I just left it at that. And then,
and you've had more than one child for this couple, right?
For the first couple, I had twins, and they are a couple who are based out of Los Angeles, and those babies are going to be 8 this coming October.
That's amazing.
They just started, they didn't just start school, but they just started back to school.
Do you keep in touch?
We do, yes.
That's so cool.
And so it's neat to see like those photos of them because they're growing and it just reassures you that you did it for the right couple. And I can't take all credit for that. Like obviously the agency vets out who they're willing to work with, and they do a really good job of matching surrogates to intended parents.
Yeah, and there's a lot of different reasons, right? You could carry a surrogacy pregnancy. You know, like you mentioned, same-sex couples are common. And then infertility is a really big deal, whether it's like polycystic ovarian syndrome. In a normal heterosexual couple, right? Sometimes it's the man's problem. There's a lack of sperm or something, what have you. Here you come in. Now, you mentioned when you changed your mind, you decided to do the surrogacy, you reached out to an agency. What were kind of the initial steps? Like, you just filled out a profile. They took pictures of you. You made like a chart, if you will. It's almost like a matchmaking agency.
It's essentially like a matchmaking agency. So it's not just filling out documents, right? That's kind of like the first level. So when you seek out any agency, obviously I would encourage anyone who might be interested in being a surrogate, don't just stop at the first one that accepts you, because there's really bad agencies out there, unfortunately. And they take advantage of girls that are newer to surrogacy, and they take advantage of intended parents for that matter. So it's obviously really good to vet out the right one that's a fit for you. There's a lot of support groups out there for not only surrogates, but intended parents. So you can get a flavor of, this is a good one, this is red flags, run away. So for me, I ended up going through my friend's surrogate agency. Obviously, she had 2 positive journeys through them. And when I went through them, the first step was filling out the paperwork. And it was basic, like background information.
Medical stuff.
Who am I? How many kids have I had? Did I have any complications during my pregnancy? And then obviously answering the tough questions of, would I be willing to terminate? Do I have any travel plans? Because you have to realize, obviously, when you commit to a surrogate journey, you might not be able to travel to Mexico on that cruise, or maybe you can't travel outside the country or let alone outside the state once you get to a certain week of gestational age in your pregnancy. And so once you get through the paperwork and the agency says, okay, and they've requested all of my medical documents, then I go see the intended parent's IVF doctor who do a complete medical examination on me. So we're talking like a uterine ultrasound. They'll put like a saline solution to like kind of blow up my uterus to make sure there's no like scarring in there. I've never had a cesarean, so I obviously that wouldn't be seen in there. But if I had fibroids or cyst or something in there that would cause concern for a pregnancy, a viable pregnancy.
Right. We call it a saline-infused sonogram.
Is it a histosonogram?
Yeah. So there's a saline infusion sonogram, which is probably what you had in the office where we put saline in there. We just do an ultrasound.
Yes.
Then there's a hysterosalpingogram, which is a little bit more fancy. We put some dye and do some imaging.
Okay.
But yeah, basically we're just looking at the inside lining of your uterus and making sure that, like you said, there's no polyps, fibroids, anything where, making sure the house, if you will, is clear, right? There's nothing else in there, right?
Right. In addition to that, because obviously intended parents are paying an outrageous amount of money.
It is a lot,
and there's no guarantee at the end of the day that this is going to be a baby or a healthy baby.
Right.
And I think that's one of the misconceptions of surrogacy is that it's an exact science and it's not, right? So in addition to that, I also have to do blood work.
Right.
My husband has to do blood work. And so they have to vet out that we have no STDs. We don't have any blood disorders.
Right.
No like sickle cell anemia. Like they're trying to rule out everything.
Right.
Right.
And like genetic things
all things.
Yeah.
I am O negative. And I've come to learn with my own pregnancies that I'm RH negative.
Right.
And so fast forward a couple of years after I already got 2 surrogacies under my belt, I was going to get matched with the husband-wife, but my blood didn't mix with their blood. And then when the baby would have been put in me, it's possible somewhere in that pregnancy that baby could have had blood transfusions. So we were able to vet all this out at the beginning, which is great.
Right.
You know, the medical technology that they have to rule these things out is good.
Right.
So I do that. Once I get past that screening of it and I'm approved, so the IVF doctor will give me medical clearance, I then move to the next step of getting a psychological evaluation. So this is where, again, I get asked a slew of questions by a psychologist.
Okay.
And he or she will make sure that I'm not crazy.
Right.
I haven't been put on any crazy medications that might make me 1 minute I'm good and the next, highs and lows. Right. I have to be stable.
Right.
There's also a check like I'm not on government assistance. I'm not looking to make a quick buck, because I think that's a misconception. People think, oh, I could be an egg donor or I could be a surrogate. I'm going to make money quickly.
There's a lot more to it.
Not how this works.
Yeah. There's a lot more to it than just making a quick buck. Right.
So once we get through all of those medical and I'm approved, then we move on to contracts.
Right. Yeah. And it's really important. I'm glad that you mentioned that because, surrogacy isn't for everybody.
No.
There's a lot of women out there that would be great candidates, but not everybody should or can do it. Not all pregnancies are super healthy and easy as yours.
No.
Right. And there's risk. Your doctors, obviously the IVF doctor, OBGYN, whatever, will kind of clear you for this.
Right.
And it's really important to listen to said professionals.
Yes.
Yeah. Because, of course, being an OBGYN and seeing this for a while, you've seen the highs and lows of pregnancy care.
Yes.
Right.
Yes.
So you said you've had twins, and how many other surrogacies?
So I've had 4 total. So my first surrogacy,
I didn't even realize that.
I've had 4 total. So my first one was a set of twins, and that was for a couple out of LA. My second surrogacy was for a couple out of San Francisco, and she was a little girl that I had.
Okay.
My third surrogacy was a little boy out of New York, and then I had his brother back in November of last year. So actually, I'm sorry, almost 2 years ago. He'll be 2 this coming November. So I've had what's called a sibling journey. Okay. And I am currently in process where I've gotten past medical, legal, psychological evaluation to have a third sibling, another little boy for the same family in New York.
Okay.
Yeah. So that will be my 5th and final. As hard as that is to say, as a woman, I recognize that we are done with our own family planning, but there's just something about having to shut the door on just pregnancy altogether.
Right.
Right. So it's like I would freak out if we got pregnant with our own baby, but I'd be totally cool if I got pregnant,
with another.
Yeah.
Somebody else's. Yeah.
I know that's hard to understand, but women who are surrogates, they get it,
Well, it's important. I mean, people like you who have nice, easy, healthy pregnancies and are willing to offer this service, it's really amazing because there are a lot of couples that can't, they try and can't, or same-sex couples that, are just looking to grow their family.
I was telling you, the hardest part for me is once I start to know people and I share my story, it's like someone always knows someone who has infertility issues. And then it's like, I have someone who I want to introduce you to.
I know somebody who will carry pregnancy.
I'm like, I can't do it for everyone. Like I've had 3 couples once ask me, and it's like, oh, I'm already in contract, know? And so that's the hard part for me. Cause it's like, I feel if I was a machine, I would just try to knock them out. But I know that's not healthy for me either, right? Like my family obviously comes first. And when I do a surrogate pregnancy, it's not just me, what I have going on. Like I obviously need the support of my husband. I need the support of my kids. I need the support of my mom and my mother-in-law, like my little village that's around me.
Right.
It's not just me. So anytime I do go into a surrogacy, I kind of always run by everybody else. Hey, what do we think about this?
Right.
Because I can't do it on my own.
Right. No, absolutely not. Yeah. Everybody's involved. I know you're carrying the pregnancy, but your whole family is involved one way or another. Kind of tell me more about, I'm interested to hear about the process before you get the embryo transfer, right?
Okay.
You have to go on probably a slew of medications, right? You can't just kind of transfer an embryo. You have to, of course, time it with your cycle, but how do they time it with your cycle? They give you medications, different injections.
Yes.
How long is that process and kind of what it looks like in a nutshell? It doesn't have to be so detailed.
Yeah. So it's different for every surrogate, right? Because our body chemistry is different and it's really based off the doctor's protocol, like what they do. Because there's a medicated cycle, which is where you would go on estrogen or progesterone injections, or you could have vaginal suppositories of progesterone. But then there's unmedicated cycles where it could be 100% natural. I've never got to experience that. I would love to if that was even an option. I haven't asked. I probably should this time. I should advocate to say, let's try a natural cycle. But then also keeping in mind, that's not my embryo, right? And if the doctor is saying, well, this has worked for you the last 4 times, let's stick to what's working for you. So for me, when I had the twins, I was definitely on injections, not only a progesterone, but I think it's called delestrogen. So I think, is that just another form of estrogen?
It's a form of estrogen.
Okay. So instead of getting it in a pill form, I got it in an injectable. And when I say it's fine, it was a lot of injections. And so it's like, instead of getting an injection every other day, I had 1 injection every day for 10 weeks. Right.
It's a long time.
So the purpose of the injections is to put these synthetic hormones in my body to, 1, get my body ready for a pregnancy, but like trick it in thinking that we're getting pregnant. Right. Naturally. Even though it's done at a medical office. Typically what they'll do is they'll start girls on birth control. And that's really just to get our cycle in sync. Yes. Regulate it, get it in sync. And then once I have a period, I will then go and see the IVF doctor within like 8 or 10 days of having my period. And they're just looking inside there, getting a baseline for what my lining looks like. Because I've learned that we don't always shed our lining, and like, you might need to put on medication to like further vet out your lining. And so my uterus gets checked. I'll go back a week or 2 later to get it checked again. And then they'll start me on the progesterone. So I'll take those injections and it obviously builds. And I'll take a pill form of estrogen. I believe it's called Estrace. Does that sound familiar?
Estrace is one. There's lots of different combinations.
I've had a few different, but obviously I stick to the generic term of progesterone and estrogen.
That's for all intents and purposes, it's all,
And so I'll take those things leading up to an embryo transfer. And so what they're looking to see is that my lining is building as that month is going on.
Right
before
the first 2
transfer.
weeks of your cycle.
Yes.
Your lining's building. And then,
And so when you go into the IVF clinic and you're kind of at your final appointment before you have the transfer, they're looking to see that your lining is over an 8 in thickness. No greater than a 14, because there's been girls that have had really thick linings and I don't fully understand why that's not as good. The best way I can describe it to you is think of like a nice little fluffy cloud, in your uterus. And you want that embryo when it's put inside of you to stick to the fluffy cloud. And then obviously turn into a nice little beautiful baby.
It's a good way to think about it.
So once I go back to the IVF clinic, they'll check my lining and I feel like I've become an expert. Like I can read and see the ultrasound, like, it's looking great. I can't recall what the term is. You might know this, but they look for some triple line. Does that sound familiar at all?
I'm not sure what term it is that you're referring to, but they're just looking at like the endometrial stripes, like the lining, so the thickness. So they're looking on the top, basically the uterus is like a big old U. It's really hard to explain this, but there's a line there in the middle. And when the ultrasound, they're looking at the kind of the anterior side of the endometrium, the posterior side, and then there's a line in the middle. And they're measuring that entire stripe. I'm not sure that there's a term that IVF doctors use for 3 lines.
And that's like, you're like ready to go when you're there. So that's exciting to hear. So once you have that appointment, then you're cleared to go see the IVF doctor. In my cases, I've gone to IVF clinics that have been in LA, that have been in San Diego, and over in Connecticut. And so Obviously, if it's the doctor that's doing the transfer, I'll see that same doctor for all my appointments, right? But like in this case, with my current journey, that doctor is located over in Connecticut. And so I get seen locally at a clinic in La Jolla. And then they just communicate to it's called a satellite clinic, right? So that way I'm not having to travel to Connecticut each time to have these appointments.
Right. Yeah, it's tough.
Yeah. So once I'm lined up and ready to go, I then will go see the IVF doctor for the transfer.
Right.
And it's very quick. I mean,
right in the office.
Yeah. You go into the office.
You don't have to be put to sleep.
You don't have to be put to sleep. I don't get any medication to relax or anything like that.
Right. It's basically like a pap smear, essentially.
Yeah, but quicker. I feel like.
Quicker, yeah. They just kind of take a look and then, they transfer put it right into your cervix.
Yes.
Essentially right through your cervix into the uterus.
Yeah. They will give me some kind of antibiotic, I feel like, that I will take just to prevent any kind of infection.
Right.
But beyond that, you show up, you put on their little scrubs or their gowns, you get rolled into what looks like an OR room.
Right, right.
But it's interesting because the lights are very dim.
Right.
There's nice soft music playing. Relaxing. It's like the right temperature. It feels like, like you're going to get a massage or something. It's very nice and inviting. Right. There's beautiful paintings all over. It's just nice. And then it's this very orchestrated show of the embryologist is in a separate room and there'll be like a monitor or like a TV.
Right, right.
And they will put up on the TV the intended parent's name up on the screen.
Oh, okay. That's
and
cool.
They'll show the actual embryo, like kind of in a petri dish.
Yeah.
And it's, they show the embryologist sucking up the embryo.
Right.
And like a syringe.
Right.
And then obviously they bring that into the room.
Transfer, yeah.
And it's like they present it. And then I'm laying there. I'll either have my husband or I've had my brother, my mom,
right.
My best friend. You're always allowed to have like a support person to go with you. And so, you sit there. There's a ultrasound monitor so that the doctor can see clearly, where he or she's going to be inserting the embryo. Yep. And it's cool. I mean, I obviously have a lot of videos of myself. This is an environment where we are allowed to video it happening.
Right.
And the best way I could describe it is if you had, I mean, I know you know.
It looks like a little game. It's really fun to watch.
It does. It's like a nice little light that's like coming through and it's just like release this little orb inside you.
Yeah.
And then that's it.
It's actually really interesting to watch. And it might be fun, maybe a different episode we can show some videos. It's actually really, really cool.
And it's like cool because now I feel like, again, I'm a professional, right? Like each time it happens, it's like, oh, there it goes. Like you have an eye for it and you can see it.
Right.
And then once that happens, you sit there on the table for about 10 minutes or they'll take you to like what they consider a recovery room and you'll just lay down for like 20, 30 minutes.
Right.
And then you're off to go take it easy.
Right. And there's no guarantee it'll take.
No.
Now you just wait a few weeks and then take a pregnancy test.
So it's like a running joke with surrogates about peeing on a stick because a lot of girls are really impatient once a transfer happens and they'll start testing as early as 4 days.
Right.
So the earliest I've ever tested is 5 days where I got a positive.
Right.
And I feel like with my body, if I don't see a positive by day 5, day 6, I'm like, oh, it didn't take.
Right.
Because historically that's what I've seen.
Right.
So you can take an at-home pregnancy test. They encourage you no sooner than 7 to 9 days.
Right.
Because the embryo has all that time to attach to your uterine lining.
Right, exactly.
So it could be premature. And then it's like, imagine if you're...
And you get like a false negative.
Yes. And you're talking to the intended parents and you could be setting them up for disappointment.
You palm them out. You're like, it's negative, but you did it way too early.
Yes.
Yeah, it's just important to wait. And, but I know it's probably hard.
It is.
So you go through all this process, 10 weeks of injections or pills or whatever it is, hormonal replacement. You go through the transfer and then now we just wait and we pray that
the baby takes.
This takes,
and then once it becomes official again, so they consider it official when you do the HCG blood test, and that typically happens 2 weeks after your transfer. So I think it's 14 days.
Right.
And then 2 weeks after that, you'll go in for fetal ultrasound for a heartbeat. And that I could share those as well, right? Like it's really cool to see that. And then obviously share that video with your intended parents. It's exciting.
Yeah, it'd be really cool to go on that journey. Then comes the hard part probably for most people. I guess for you, it's the easy and the fun part is carrying the pregnancy.
Oh, I love that part. Right? Yes.
You love that part.
That's the.
Yeah. But it does, the curious thing, and you say you're an open book, things I've been curious about, and I'm sure a lot of people are curious about, right? It's not just you in a vacuum carrying a pregnancy, right? Everybody's involved.
Yes.
Your husband.
Yes.
Your kids, right? They know you're pregnant, but they're not going to have a little brother or sister.
Right.
You have to kind of, this is for parents and you're doing this selfless act.
Yes.
How, if in any way at all, does it affect your relationship with your husband? Like, do things change there? Do you notice that?
Yeah, sure.
Things are a little bit different at home.
Yeah. So I have a very, very supportive husband. And when I did my first surrogacy, it was a learning experience for us both.
Right.
Because those were not our babies. Right. But yet he still cared for me as his wife, as she's pregnant.
Right.
I have to do these extra things for her because she needs the help. Right. Even though for the most part in my pregnancies that we've had of our own children, I'm pretty self-sufficient. Right. Something I need to talk about too, that I didn't experience in my own pregnancy, but I tease my husband about, right? You are showered with gifts from your intended parents. At least that's been my experience.
Right.
And they can be something as small as like, maybe like my first couple gave me, prior to my embryo transfer, they gave me a fertility bracelet. It was like the goddess of fertility or something.
That's awesome.
It's a small token, but it was personal to me.
Right.
And so that particular
They're
couple,
just so thankful that you're doing this.
Yes. And then writing me letters, like just little sweet things, bringing me flowers, like, and I would look at my husband and I would say, hey, I didn't get a push present, or I didn't get we're going to get pregnant present.
You're slacking, buddy.
Yeah. What's going on here? And so although that was great, then they started like showering my kids with gifts. One of the intended parents worked for Disney in the licensing department.
Okay.
And so he would shower my kids with like Disney Legos or costumes. And then I was just like, I very much appreciate that, but it was hard. I'm not a gift giver. I should say I'm not a gift giver. I am, but I feel like it's not my love language to give. Right. And so what I would receive, it would make me feel special, but then I felt like this obligation where I had to do something back. And so anyways, going back to my husband, that was something in a jokingly way that I would say, hey, like, this is such a nice little benefit of, but I couldn't assume that that's how every couple would treat me. But for John and I, no, I mean, like, he too would have to go through the psychological evaluation of it. Oh. Yeah. Like, so even though
it's important. I'm glad you bring it up. I actually didn't even know that.
Yes. So a lot of people don't realize, like, he has to go through the blood work. He has to go through the psychological evaluation.
Right.
Because again, he is my primary support person. And when he's not there, it's like, then I lean on the rest of my village. And so to be honest, over, I would say the last 8 years, not much of our marriage has changed when I do surrogacies.
Right.
Sure, my kids can be impacted at times because I might be tired at different parts of the pregnancy.
Right.
I might lose my patience a little more because obviously the hormones.
And you can't do all the physical activities maybe you used to do.
Yes. So
towards the end.
I have heard that from my 2 older boys. Like if we went to Disneyland or if we went to a theme park and it's like, oh, sorry, Mom, you can't go on the ride.
Yeah.
But I try to explain to them there's something greater here going on and someday you'll understand. But right now, like, I can't do that. And then with my daughter, for her, she always wanted to be held. And it got to a point, I cannot pick you up because after you transfer, you're not supposed to be lifting more than 10 pounds, And so explaining that to them, that would create some, disappointments. But for the most part, we've been consistent over the years.
Right. It's really good to hear that you have a great support system. I'm sure it's a little bit hard, things in your relationship may not change, but, things I was kind of curious about, like dating your husband again, or like the intimacy, like how does that change things? Because in his mindset and your mindset, it's not your child. Like, does that change anything there? Like in the intimacy department?
No, we don't.
And that's it. Cause I know and you're an open book and I know we've known each other for a while, but it's something that I was thinking of. Like, I know when my wife and I had kids, things change, but I know that was my doing.
Sure. Right.
So now it's interesting to think about.
So there are definitely strict boundaries that are set, especially when I'm in a contract. And for example, we are not supposed to have intercourse 6 weeks leading up to the embryo transfer.
Okay.
And 6 weeks following the embryo transfer.
Yeah.
And there's obviously reasons for that.
Right.
There are lots of stories out there of women who have had intercourse during those periods and ended up pregnant with their own children.
Yeah.
But obviously not knowing that until the baby was delivered. Right. And then going through a lawsuit to get your baby back, like really bad things.
Yeah, it's a mess.
So
there's risk for infection. There's risk for miscarriage. And then that really weird risk, you say, having another like a woman had a
second pregnancy. 2 embryos transferred in her.
Right.
1 embryo took. That was the couple's.
Right.
And then she had like a delayed egg release that also got fertilized by her husband.
So one was her own kid.
One baby came out as a Chinese baby and the other baby came out as a mixed African-American Caucasian baby.
Right.
And then her but was compensated for a twin pregnancy And so obviously the Chinese woman who paid for this pregnancy, she wanted both babies.
Right.
And in our contract, there is specific language that any baby as a result of this pregnancy belongs to them.
Right.
Right. And like, I'm kind of like relinquishing those rights.
Yes.
So from what I understand, that lady got her baby back like 4 or 5 months later. But yes, so we are very strict about no intercourse. That doesn't mean we can't be doing other things to keep things lively, right? Because let's be honest, it's hard.
It's so important.
Obviously, if I have to do the vaginal suppositories, I hate that because that puts a kink in things.
Right.
But we do make time for each other because we recognize that that is important.
Right.
And our time is short. You know, my husband, he works away during the week and he's home on the weekend. So it's like we make our time count together.
Right.
And we have over the years. I would say with my first surrogacy, we were definitely a little more delicate.
Cautious,
because I don't know,
you don't want
to hurt anything or, you know, and so I think there was that. But then, you know, as it's gone on.
Right. Yeah. You've gotten used to it and you've gotten used to it.
Yeah.
Now you mentioned, you know, somebody was compensated for a twin pregnancy.
Yes.
So we don't have to get into the details about kind of what you were paid and all of that. Sure. But obviously you get compensated in some regard, right? So how does that side of things work?
So I can tell you, obviously it's been 8 years since I've been in this realm. Starting the like base pay for surrogate pregnancy was anywhere between $20,000 and $30,000 total.
For the whole pregnancy?
Right?
Do you get like a lump sum or is it like paid monthly?
You get paid monthly. So essentially there's like milestones, right? Okay. So once you confirm you're pregnant by blood work, once you confirm you have a fetal heartbeat, once you start medical injections, you know, so there's these little milestones that you hit and you'll get a certain agreed upon amount.
Okay.
So I would say years back, it started off between $20,000, $30,000.
Okay.
If you had a twin pregnancy, they would automatically add an additional $7,500.
Okay.
And so those payments, again, you didn't get it in one lump sum. It would come monthly, right? They would spread the payments out. Because again, there's milestones. Right. If I delivered the twins like prematurely, maybe I wouldn't get, you know, that full amount. Again, all this is like outlined in the contract.
Right. And they're all a little different.
Yes, each one could be a little different.
Right.
Fast forward to now, women are getting compensated anywhere from $50,000 to $100,000 as first-time surrogates or experienced.
Right.
Now, California surrogates are definitely getting a much higher compensation, which I cannot understand why that is, because I know our law, I do understand like our laws here are very surrogate friendly, but what I don't understand is what makes our state different than another surrogate friendly state. Why is their compensation lower when they're providing the same service?
Right. I wish I could give you an answer.
And so that's where when you're looking at different agencies where you need to be careful that they're not taking advantage of a new surrogate.
Right.
Yeah.
Right. Interesting. And then I would assume that the intended parents kind of pay for the healthcare associated with it. It's not something that you go on your insurance or you pay for.
So,
they handle everything.
If I had insurance that was surrogate friendly, unfortunately, my current insurance is not. So the family that I am in a journey with, they would take out a separate insurance policy on me for the duration of the pregnancy. And obviously, anything that happens at the IVF clinic prior to that insurance being in place, they're paying for that directly.
Right.
And if I do have to come out of pocket for something, I would simply expense it through my agency and I would get reimbursed on like a monthly basis.
Right. Got you. Now, I think a question probably most people have, I certainly have, is, you know, we talked about the financial side, a lot about the leading up to it, because that's a big portion of it. But I always wonder from the surrogate standpoint, you carry this baby, you're one with the pregnancy, which is you build this attachment. You have to build some kind of attachment. How hard is it, or what is that like when you deliver?
Okay.
Like, how do you deal with that?
So that's like, other than the compensation question, the attachment is like the second question I always get. Like, how can you give up the baby?
Right.
I'm not giving up my baby.
You know, going into it.
And so obviously mentally, I am big on expectations. If you can give me an idea of what I can expect from this based off of other people's experience and not just the straight out of the box, oh, I had a great pregnancy, I was able to get the baby up, like hearing different women's experience. I join a support group once a month through my agency where I get to hear where different girls are at in their journey. Okay. And that really sets in perspective to be grateful for what I have experienced and not experienced, right? And so for me, my first surrogacy, my simple response back to people when I got asked, I was like, well, I don't know, I haven't gone through it yet. Right. So once I experience it, I'll let you know. But I'm preparing myself mentally that these are not my babies. I didn't know how I would respond. But what I could tell you in that experience, I had one of the dads with me in the delivery room.
Okay.
I was able to deliver both of them vaginally. And when they came out, my heart was more with the dad who was sitting next to me because you could tell he was very nervous. This was a first time experience for him. And his concern was for me, like, are you okay? Are you okay? I'm great. Like, I'm used to having my own babies. Like, yeah, I don't know. It just felt very natural and normal and comfortable for me.
Yeah.
Once those babies came, there was obviously a team of people there.
Right.
So it's not like I'm baby bonding or doing skin to skin.
Right.
They take the babies, they clean me up. I get wheeled back into, postpartum room. Right. Yeah. And there's my husband waiting for me and I get to rest.
Right.
So one of the benefits after having the baby is I don't have a baby to take care of.
Right.
And that was really great.
That was a relief. And it probably like filled your cup to watch that you just really fulfilled this parent's dreams, you know?
Yes.
Like, so it was really kind of reassuring for you,
yes.
But also I guess you have to have the mindset going into it. Yeah. I always wondered, that side of things, because I can tell you the medical side of things all day long, but how hard is it to detach? Because those hormones, the oxytocin from labor, which is, forms of bonding. And then all of the hormones of pregnancy, you are still experiencing all of that.
Yes. So what's also cool with all of my surrogate journeys is after so many hours of resting, I'll then reach out and say, okay, I'm ready if you guys want to come visit.
Right.
And then they come in there, you get to hold the babies, you got to talk about the experience, you kind of get that. And I obviously, in that particular situation, I did have my family come to the hospital so my kids could hold the babies and they could see this was what was inside of me.
Right.
This is their dad's, not your brother's, not your sister. But I will tell you with that particular journey, once it was over, I felt, like a Disneyland effect, right? I had this like amazing experience and then 6 weeks go by and I feel like the communication went like this.
Yeah.
And I was like, and mind you, I was pumping, I was providing breast milk for them. And the way that works is when you go into the contract, you either decide up front, do you want to provide breast milk? Yes or no? I obviously said, yes, I would.
Right.
They were willing to compensate for it. And so I would pump and I would ship the milk overnight to them.
Right.
And I think it's great.
And how long did you do that? How many months?
For the twins, I think I did 4 months for them, 4 or 5 months.
It's amazing still.
Yeah. And then I was just like,
commitment.
I was ready to have my body back at this time.
Right.
And the communication went down. Right. And so that's where if I felt anything was like, no one prepared me for that. I think had I had an expectation set of, well, at some point the communication's going to stop.
Right.
And then I had to tell myself, well, they're new dads and they have twins.
Right.
So maybe they're busy and it's like, they don't have time to text me every other day or ask me how I'm doing. Because before that, they didn't have that time. Right. They had a bunch of time on their hands.
Yeah.
And so that's how that experience went. But then with my second experience, I really bonded with the parents. And when I delivered their baby, the doctor put the baby on top of me, which was fine. But I felt like she was trying to root to like find my nipple to breastfeed.
Yeah.
And I looked over at my husband and I said, get the baby.
Yeah.
Because I was having feelings of like, she was kind of getting a little fussy and I felt this maternal instinct, like I need to nurse her.
Yeah.
And I think a part of that had to do with my relationship that I built with these two men over that period of time.
Right.
That it was like, I would do that for them.
Right.
But I had a boundary of no, that was for just me and my babies.
Right.
I have to have boundaries.
Some kind of boundary. Yeah.
I'm willing to pump and I do in the hospital, to get the colostrum, but I can't like nurse directly.
Yeah.
But that was the only time where I had that like, I didn't know what to do. I felt conflicted. And then thankfully they took the baby and they could do their skin to skin bonding.
Right.
But then after that, the next two little boys I had, no problem. No, concern.
Interesting. Yeah.
Yeah.
It's really interesting. For sake of time, we'll probably wrap this up. I feel like I could talk for hours about this. This is like the most interesting thing. Like I say, in medical school and residency, you learn all about like the IVF.
It's evolving.
The OB stuff. Like I've gone through, in residency training, we've gone through IVF training and I've done some of these procedures and it's really fascinating on that side of it. And it's awesome to provide that service. But hearing it from your perspective, I was so excited for today's talk because these are things that I would never know even how to answer, when patients...
every time I go through a journey, of course I vent to my mom every day of the week, right? I always am told either I should open up my own agency or I should write a book, right? Because I definitely have a lot of information and I want to share this, right? But I'm just one of many, right? And now surrogacy is no more taboo. It's starting to become, I think, more accept it from like a worldview.
Right.
But there was a time where it's like, you don't talk about it.
Right.
You know, I'm happy to share about it though. I think it's important to educate because there's a lot of misconceptions about it.
Right. Right. Well, I appreciate it. Thank you so much for taking the time to do this and educate me and everybody out there. It's been, really interesting.
Thank you. This was fun.
Thank you again. Well, that wraps up another episode of the Kvara podcast, and we'll see you next time.